Well, good afternoon, everyone, and welcome to a joint committee session between our Health and Human Services Committee and our Education and Culture Committee. I will turn it over to Co-Chair Albornoz in a moment to give some remarks, but all of us know all too well about the impacts of COVID that we've seen across multiple sectors of our government agencies, departments, but also across our lives in general. And our school system and our school health system within our schools is certainly nothing that bears an exception to that. Today, we are going to have a briefing and discussion on the impacts of COVID and what it's had on our school health services and our healthcare continuum that certainly is responsible for our children within Montgomery County Public Schools. I'll just lead with the fact that we are very happy and would encourage everyone to avail themselves of the vaccine that has now been approved for ages 5 through 11. And so we encourage everyone who is able to please try and make an appointment to be able to utilize your private providers, including your healthcare professionals that normally see your children, in addition to our multitude of county sites, as well as those private providers, your CVS's, Walgreens, Walmarts of the world that are out there that are also disseminating the vaccine. We want to make sure that as we lead into this very busy time frame of our holidays, to where many people will be out, they'll be shopping, they'll be seeing families and interacting together, that we make sure that some of the youngest people in our community, some of the most vulnerable, are safe. And so from that perspective, we want to make sure that all of our parents try and avail themselves of that opportunity. But did just want to briefly just give some context as to where we are. We know all too well on how this has had a tremendous impact on the ability for us to continue to focus on the day in and day out. And that applies to our children as well. To be focused on learning, we know that you have to be healthy. When we saw some of the kids who got the vaccine in their arms yesterday, late in the evening, and you saw the interviews from them and what they said, those words of children about, I just wanted to be safe. I wanted to make sure that I could keep going to school, that I could continue to learn. Those are the things that we want to deliver for all of our children within Montgomery County Public Schools. And so for that, we certainly are going to understand today, working with Dr. Raymond Kroll, our director of our Department of Health and Human Services, Dr. James Bridgers, who's our acting public health officer, Mr. Jimmy DeAndrea, who's the chief of staff for Montgomery County Public Schools, Dana Edwards, who's the chief of district-wide services and supports for Montgomery County Public Schools, and Heather Dublinsky, who's the coordinator for student welfare and compliance with MCPS. We want to make sure that we're all coordinated around this effort of making sure that we can understand in a more in-depth way what it is that we're doing to keep our kids safe and make sure that they can keep going back to school, keep learning, and be in the classroom. And so with that, let me turn to Co-Chair Albornoz.
Thank you, Chairman Rice. Well said. I'll just be brief and say a few things. Just all of us have been so impressed and just so appreciative of the sacrifice of our health professionals across the board, but in particular our school health nurses, who prior to the pandemic, we know were under a tremendous amount of stress with all of the responsibilities that they had to carry out. And I was proud to stand with all of my colleagues to unanimously support adding our school health nurses to ensure that we had greater capacity. And who would have known that that could have foreseen how important that would have been? Because as challenging as things were prior to the pandemic, I can't even imagine how difficult it would have been had we had the types of staffing shortages we had then. And there was burnout then. And we ask so much of these professionals. And so it's important for us to be able to hear from the leadership, both from MCPS and HHS, on what strategies we are undertaking to both support their work, to leverage that work, and of course, and most importantly, to keep our children and youth safe and healthy. And we also acknowledge this is complicated, and there are many things out of our control, and that there is a lot that can and should be done. I also want to acknowledge, before we transition to the presentations, just through the pandemic, our school health nurses have actually been on the front lines because school was not in session. They were redeployed to assist with testing, to assist with contact tracing, to assist with providing vaccinations across our entire county. So they have not stopped working throughout all of this. And I know this council and the executive branch as well stand deeply committed to ensuring that we provide the level of support that we need to ensure they can do their jobs. So thank you very much to everyone who we will be hearing from this afternoon. And thank you, Chairman Rice, for your partnership and collaboration on this and future sessions, because I'm sure this will likely not be the end. But we look forward to this discussion, and I yield back to you.
Well, absolutely, Mr. Vice President and Co-Chair. This is certainly something where we know we will continue to have these conversations well into the remainder of the school year next year. Unfortunately, we know there will be spikes. We've heard from Dr. Bridgers and from Dr. Stoddard about some of the challenges that confront us with the wintertime and the peak of flu season, and how that will also have health impacts not only on children, but also their families. And so from that perspective, we just need to do everything we can to make sure everyone is safe. So with that, I want to turn this over to Ms. Yao and Ms. McGuire, who as always have laid out a very effective manner in which we can follow along with really touching on some of the salient points, but did again want to thank everybody for their partnership. And to all of my colleagues, when we're done with the presentation, please just go ahead and text me with any questions that you have so that I can put you in the queue. And so with that, I'll turn it over to Ms. McGuire and Ms. Yao.
Thank you, Mr. Rice and council members. I'll just very briefly highlight that in addition to the very extensive discussion that we'll have today around the school health services, as another component of that, both MCPS and DHHS will be speaking also to some of the coordination and connection efforts that they have together as agencies, partly through the COVID Advisory Council or Advisory Group, not sure what the right name is, that MCPS has convened. And again, just that continual relationship that the agencies have strengthened that partnership throughout the pandemic, and we'll be hearing some elements of that work today as well. In your packet, you do have background around the staffing and function of the range of school health services and programs that are in our schools, just again as context for the rest of the discussion. And with that, I believe that MCPS will kick us off with a brief presentation, and then DHHS will make remarks following that.
Thank you very much, Ms. McGuire, and good afternoon, Chairman Rice and members of the committees that are here this afternoon. Thank you very much for the opportunity to share. We're going to begin by just sharing a couple of updates that are related to MCPS specifically. I know that we gave a significantly more detailed briefing on Tuesday, so we're really building on that work. I do want to begin by just acknowledging what Ms. McGuire alluded to in terms of how valuable the partnership between MCPS and DHHS is. We are incredibly grateful for everything that DHHS has done consistently throughout this pandemic to really work together and partner with MCPS. We know that we can consistently reach out to DHHS and work together to collaborate to solve challenges that may arise, so that ultimately we can do what's best for students each and every day. Because as I said during the full council briefing on Tuesday, at the end of the day, our goal is to first and foremost make sure that our schools are safe and that we can have as many students in school as possible in terms of looking at the processes and practices that we have in terms of quarantine and other things related to health and safety. So with that being said, I'm just going to share my screen for just a moment. To start with, I did want to highlight one of the pieces that I mentioned on Tuesday as a follow-up, and that is related to the medical officer position. As you are aware, we decided back in September as part of Dr. McKnight's 5-point plan that we would be hiring a medical officer who would serve as the primary liaison to DHHS from MCPS and have an on-staff medical expert, similar to what a number of other school systems throughout the country have. So in October, we advertised the position using our normal administrative advertising processes and procedures. And ultimately, we got a very small number of candidates. And so after reviewing the candidates and having some conversations with a number of staff within MCPS as well as outside MCPS about next steps, we have decided to go ahead and re-advertise the position for an extended period Typically, it would be 5 business days based on our normal procedure. In this case, we're extending to just over 2 weeks. And then we will also be advertising on multiple medical job boards as well, as a way to attract a larger pool of candidates with a wider range of experiences, because we know how critical this position is, and we want to make sure that we get the right person for the position. The next update that we would like to share is around the COVID-19 Operations Advisory Team, which was another critical point of Dr. McKnight's 5-point plan in terms of the school system COVID-19 response. And to share more about that, I'm going to turn the presentation over to Ms. Dana Edwards, Chief of District-Wide Services and Supports.
Thank you, Mr. DeAndrea. Good afternoon, Councilmember Rice, as well as the other council members that are on the phone. Thank you for the opportunity to return again this week and share some more information on our COVID-19 Advisory Committee. As Mr. DeAndrea shared, a part of Dr. McKnight's 5-point plan, one of the components was really to look at a way in which we are strategically working with the greater Montgomery County community to be able to look at and advise us on all things related to the operations of COVID-19. As we began to plan for this year for the school system, we all became keenly aware that the Delta variant had a different pathway in which it wanted to take us, in that we needed to return to many of the measures that we did last year, but we knew that we were going to open for 5 days a week with in-person instruction. So what you see in front of you is our district strategic initiatives implementation plan, and it focuses on all of the different areas that we know are critically important to be able to work as a school system throughout this pandemic, and even when we come out. The one area that we did add that we know that we need to be highly collaborative around and really focus on a daily basis would be our COVID-19 operations team. We established this team to make sure that we were engaging with a multi-group of stakeholders on a weekly basis to really be thoughtful and mindful around how we reach members of our community, how we make sure we stay engaged, and the clarity in terms of our communication and really collaboration around the different areas. Jimmy, you can go to the next slide. Today marks the 5th meeting of this multi-stakeholder group, which includes about 57 members. And what you see in front of you are our different advocacy groups and operational groups throughout Montgomery County that really embody the diversity of our actual county. We wanted to make sure that we included our partners, of course, from the HHS. We have students who are on this group, our parents as well as we wanted to really have medical professionals who worked with us throughout this entire process. So that as we were grappling with some of the things that come up around masking, how we communicate, now we have the student vaccines that are out, and really kind of staging that and really being collaborative and thoughtful around the communities in which we wanted to reach and how we target them. We wanted to make sure we had a wide array of perspectives. This group, as I said, we will have met 5 times today, and we do meet weekly. What we do know with COVID is that the landscape changes so very quickly. So we want to be attentive to that through our communication and then our openness of the work that we actually do together. Some of the areas, what you see in front of you are the purpose of our committee. And this is really an opportunity for us, like I said, to grapple with different things. We are a recommending body, but what we have found is many of the things that we have discussed and talked about, we have taken outside of this team and really built on to see implemented throughout our system. And I'll talk a little bit about that. Every week when we come together, one of the key points that we do, we take a look at data. We review data around positive cases of students and staff. We also take a look at individuals who are entering quarantine, those who have close contact with positive individuals, as well as close contact with asymptomatic individuals. And we look at how many of our families have completed the consent to do testing. This is a driving force for us, one, to be aware of just where we are in terms of the landscape with those different areas, and for us to be able to look at the longitudinal rise and or fall of each of those different spaces so that we can be attentive to next steps. I'm sorry, Mr. DeAndrea, if you could go to the next slide. Some of the topics we've discussed, most recently, we wanted to do some active preparing for the vaccinations for our children ages 5 to 11. So for the past maybe 4 weeks, we have been discussing the best way in which for us to really be able to get ready and engage our community around this particular area. Working with staff at MCPS and DHHS, we had staged some of those areas in which we knew we wanted to be able and where we wanted to be able to vaccinate children. But what we worked on together as this committee is to really create a survey to be able to send out to our families to really determine our families who had an interest in having their children vaccinated and or people who may not have had an interest. That was going to be able to drive our next steps to determine what we needed to do and how we needed to do it if we needed to engage families in a different way. In addition, we've looked at how we target our communities, specifically when we think about our communities who may have had higher COVID rates than others and or lower vaccination rates to make sure that we are geared and prepared to be able to support with the vaccination of students. And our vaccination clinics will begin this weekend. And we have identified multiple locations, many of our middle schools within our system, where we'll be staging vaccination clinics along with our partners in DHHS to be able to vaccinate as many students as humanly possible over this particular weekend. We use this, of course, in conjunction with what our pediatricians will receive, but we want to be able to provide this service in the community, and we could have only done this with our partners who participate with us on our COVID-19 advisory committee that we affectionately call COAT-19. Two other areas that we have been able to tackle during our time together is say yes to the test and test to stay. We've had a team of individuals on this committee really looking at how do we increase the number of families who have provided consent for their children to be tested within the schools. We've looked at what our communications have been. Have we communicated in the right way? And is it matched where we see our numbers to be the lowest? We, especially at the time prior to the vaccine coming out, wanted to make sure that our elementary families had as much information as possible. And are we matching our communication for the way in which people receive it at this point? Email and websites we know won't do. And so how are we engaging through door knocking campaigns and or using our partners who actually work with us and our advocacy groups on this committee to also be those credible messengers within the community. And with Test to Stay, we have to work on those logistics again and really considering how it would be deployed at our schools and how we consider what communication looks like to children, families, and the staff members we work with. Coming up next, which is not listed here, and it was mentioned earlier, we know we have our Thanksgiving and winter break that are on the horizon. And we really want to think about how we continue to breathe those safety measures, what we need to communicate, and what are some things that maybe we need to be doing with our communities and really thinking about messaging during that time. So even though we have safeguards that are coming and for our youngest students, and we also have safeguards for many of the adults, and the safeguard by that I mean is the vaccine, we still have to keep in mind that this year, this holiday season, when we come into winter break, as well as for Thanksgiving break, this will be the first time that many families will have had the opportunity to really come together within the last year and a half. And how do we support that, and how do we be safe knowing that we're still operating within this pandemic? So this has been one of our areas that we have definitely been able to work with many of our partners and really thinking about the health, wellness, and safety of not only the students in MCPS, but we know that when we do these things together, it protects all citizens within Montgomery County. Thank you.
Thank you, Ms. Edwards. I will now turn the presentation over to Dr. Cole.
Thank you, Mr. Jandria. And good afternoon, Councilmember Rice, Councilmember Alvarez, Councilmember Navarro, and colleagues. Pleasure to be with you all today, and happy to talk with you about school health services. I want to start, though, by saying today is a good day. We are vaccinating our youngest children, some of our youngest children in the county, and it has been a pleasure work with MCPS and to watch the team and to work with the team getting ready for this moment. All the lessons that we learned over the last 10 months have come to fruition in this process. We are working with our partners, we're working with the schools, and we have figured out ways to do this work as quickly and as equitably as we possibly can. So I am pleased by where we are at this point. I want to say thanks to the staff of public health for all their work, and to school health, my school health staff in particular. I am honored to be the head of a department that has done this level of work and part of a team of school health professionals that have managed to your point earlier, Councilmember Rice, stay the course and do some of everything that needed to be done in the last 20 months to get us through this pandemic. And a last special note of appreciation to Joni Glick, who heads our school health nurse services and who is retiring this year after 30 years. She is deeply appreciated and will be deeply missed. And so Joni, just a note to you, if you are listening, thank you for all you have done. Very much appreciated. Our school health staff, we have in school health, when you add nurses and you add our school health techs together, we have a total of about 276 full-time equivalent positions that are operating in partnership with MCPS. That works out to be about 342 staff in school health programs services. We, along with council a few years ago, discussed the ratio of school health nurses and school health staff for school students, and agreed that we wanted to put a nurse in every high school and middle school, and for every elementary school that was over 850 students. Those were our targets. And the elementary school sizes vary, but that's somewhere between 4 to 5 schools typically that are over 850 schools. At present, all of our nurse assignments are covering 3 elementary schools along with the school health techs, except for Kerwin. Kerwin assigned elementary schools, and there's a special number there. It was agreed with council several years ago that we would add 26 nurse positions over time as the budget allowed. So in FY20, we added 6 of those positions, and in FY21, we added another 10, raising that to 16. In FY22, with the pandemic, we put a hold on that because of the pandemic, because we didn't know where we didn't know what the status was going to be, or what our need was going to be. But for FY23, I can say that our proposal at this point is to bring an additional 10 FTE nurses into the operation. So we are back on track to try to bring those numbers up to where we need them to be. In school health technicians, we have 1 per school health room across all of the school systems. There are a lot of things we can talk about around this that we can get into in terms of conversation. But I will say that we have, of course, had a number of vacancies and a number of recruitments. This year, we started school with 22 vacancies in our school health room technicians, and as of this moment, there are 10 vacancies. And we started the year with 31 vacancies in school health nurses. And at this point, we're down to 12 vacancies. So we've had people who retired, people who've moved on, and which is the case every year. The recruitment has been slower than we would have liked, but we are working to make sure that they are staffed up as quickly as we can. We continue to do that process. To help deal with the gap, we've reached out to a consulting firm, a temporary staff agency, to help us identify staff as a stopgap measure. We've hired 48 contractors, I think, up to 24 nurses and 24 licensed practical nurses to cover the health rooms, to make sure that we have coverage in the schools. And in addition, we have done, as we realized we had to do some work around supporting our school health staff in accomplishing testing. We contracted with Integra to staff the triage rooms and to perform rapid tests and antigen tests, and to enter data and to wait on students and to work with students in the school system who needed testing as a result of being symptomatic. That gives our nursing staff some relief so that they can continue all of the many duties they have to do during the course of the day. We currently have integrated staff in 74 of the schools. We still have our school health staff doing work around testing and rapid testing where necessary. But this gives them a much needed break and some much needed help. And then finally, we have through our Athena broker system, we have clerical staff that are doing 12 contractors to help support immunization reviews, and we've trained them up to do that function to make sure that our students are getting immunized as needed in the system. So I'm going to stop and turn it over to Dr. Bridges to talk a little bit about what other kinds of things we've done to reduce the workload on our staff and to try to increase our capacity to serve our clients, our students. Dr. Bridges.
Oh, good afternoon, council members and our MCPS partners. Thank you for all that you continue to do to help us as we keep our children in school, as well as the vaccination effort that we have happening this weekend and actually beginning today. When Dr. Kroll and I looked at the report and providing a qualitative summary to council this afternoon, I should say, we wanted to provide some of the narrative, and so some of the narrative that you hear will include those voices from our school health services staff. Thanks again to Ms. Glick and her team, our senior administrator, and I apologize for the external noise. We have the landscapers in the backdrop here at Dennis Avenue Health Center. But we wanted to include some of those qualitative descriptors. So they will be long in some cases, and some they may be shortened. As Dr. Kroll indicated, we will talk about some of those staffing challenges that we have, our immunization rates, and what we're doing to continue our support and staffing at our school-based health and wellness centers. And so when we look at the additional job description and responsibility assigned to school health room staff since the return in in-person learning, including COVID testing and tracing, and what these impacts have provided, or the additional responsibility on staff. In February of 2021, school health nurses and school health room technicians returned to in-person school after spending 11 months supporting the public health services pandemic. Our school health nurses and school health room techs provided support in our vaccination and our testing strategies, and were often on the front line, both external to any brick and mortar spaces, but also in our mobile spaces as well. Their jobs had expanded to include COVID prevention and response, increased need to assist families in assessing missed immunizations, additional school assignments and larger workloads, data collection of COVID specimens, training of agency staff sent to help, learning to function in multiple locations simultaneously, and continuously providing support, information, and reassurance to students, staff, and parents who are overwhelmed or were overwhelmed by COVID and lost academic time. They identified students with symptoms of COVID-19, isolated them, communicated with their parents about isolation, quarantine, and provided resources for COVID testing, and worked with school administrators to identify close contacts. We understand and wholeheartedly recognize that significant time was required to answer students, Montgomery County Public School staff, and parental questions about COVID-19, such as testing, isolation, and quarantine. We also needed time to listen, support, and respond to fears, anxiety, and anger about the protocols that kept students from being in school after almost a year at home. Initially, our MCPS partners wanted our school health services to respond to the positive attestation of our MCPS forms and follow up on students and parents to report absences. And again, this was and continues to be a collaborative effort. But because of the limited resources, school health staff spent a lot of time in follow up and responding to the potential positive cases that may have resulted in our rapid antigen testing strategy that we deployed in the fall of 21. We continue to test occurs in our triage room, which are away from our health rooms. Parents are notified about their children's symptoms and ask for consent for testing. Again, these are additional responsibilities that go along with them being our school health service nursing team and our school health techs to provide somatic care every day in our Montgomery County Public School system. Staff are often monitoring students who are away from the health room, while the line continues to grow outside of students waiting to be evaluated for other illnesses and injuries. If it isn't an emergency, care waits for the school health staff to return from the triage room. School health staff learn of student positive cases from COVID also through parents, parental reports, communication from our communicable disease and our CD&E program, or testing that occurs in school, both weekly screening testing and testing of students who are symptomatic at school. They continuously and effortlessly work with our MCPS partners and staff to identify close contacts and initially started line lists that are sent to our communicable disease and epidemiology team for contact tracing. Again, due to resources issues, this task is now mostly done by our MCPS contractors. A core group of school health nurses who experienced the initial COVID outbreak team for schools, camps, and daycare continue to serve as a resource and liaison for COVID questioning and monitoring positive cases known to school health. Our team continues to manage communicable disease in school and has always been a school health role, but now it consumes many hours of the day instead of the occasional case of a whooping cough or lice or meningitis. School health staff have had to be in multiple locations within the school at one time, escorting 6 students to the triage room for evaluation of possible COVID symptoms, in the health room, providing care for sick or injured students, responding to emergencies on the school campus, off the school campus, and even in the triage room while waiting for parents to come pick up their sick students. Emergencies occur every day in schools, and our school health staff have been very responsive. Many MCPS school staff were experiencing significant anxiety about COVID and angst, and our school health nurses help collaboratively to work through any staffing shortages that may have been experienced either through additional support and or in collaboration. So we have worked together to serve as support mechanisms, escorting 6 students, monitoring students, waiting in triage room, and covering school health staff who often can't take a break because they are multitasking in many roles and responsibilities. So that's just a qualitative snapshot of what our staffs and our school health room services and school health room techs have endured over not only the past 20 months, but also in the past 2 or 3 months as school began to open. Now, they continue to support our immunization strategy in collaboration with our MCPS partners, and I'm pleased to say that 98.2% are compliant. We continue to operate immunization clinics daily from 8:30 a.m. to 4 p.m. We know that COMAR mandates that all kindergarten and grade 1 and 8 students have hearing and vision, and we continue to work to provide those screenings, but I must admit that many of those screenings have been delayed until at least January 2022 in order to divert some of the staffing challenges that we have and respond to not only our modified quarantine efforts, and our testing efforts. We continue to look at targeting resources. Our school health services continue to support and have support from our MCPS partners to provide more detailed ongoing information about modified quarantine as it resulted, and as Ms. Edwards indicated, doing our modified and quarantine exposure, where we look at those strategies that continue to lessen time at home, increase more in time and learning environment, and looking at when students can modify and return to school earlier. We continue to look at hotspots in collaboration with MCPS and identifying those underserved areas and those at-risk areas where we have used census data, where we've used the CDC data and other data points to identify those areas where we may have had lower vaccination rates. We created an equitable and accessible strategy for our pediatric vaccination activities that will occur this weekend. We've looked at many of these areas, and we continue to identify where shots are needed, but also more resources are needed within the county to support our school-age children. We continue to staff our school-based health and wellness center. The school nurse and health technician work to support all of our somatic services at their respective 14 school-based health and wellness centers. There are 9 at elementary schools and 5 at high schools, with another high school opening next year at Kennedy High School. This will bring a total of 15 school-based health and wellness centers. Again, our school-based health and wellness centers are fully functional and operational pre-pandemic, and we continue to provide the support through our contractors with the Catholic University and the wellness centers for children, pediatricians, and associates. These contracts provide a school practitioner for 4 days a week and a physician for a half a day a week to render somatic care again to those services for children and their families who are enrolled in our school-based health and wellness center. And lastly, we continue to respond to any vacancies that Dr. Kroll indicated based on our analysis and where we are as providing school health room nurses and school health room techs in all of our 208 schools. I'll stop there. Thank you for the opportunity to share those voices from our school health team, and I look forward to answering any question that council has this afternoon.
Thank you very much to all three of you for certainly laying out all of the great work. As you heard Chair Albornoz say at the beginning, we owe a debt of gratitude to all of the staff that has continued to do everything they can to keep our kids safe. And so really want to echo those sentiments. I did just want to ask 2 very quick questions, and I'm going to turn it over to my co-chair, Vice President Albornoz. But Dr. Kroll, you've made great progress when it comes to locking down some of those vacancies from the 22 to 10 and the 31 to 12. And so that's great. But we know we'd like to close that gap in those vacancies that continue to exist, because we know the need continues to grow and the workload continues to increase. And so is it possible for us to offer additional funds? Is it possible? I know that we have a set window for positions in county government. I know that we set those parameters. Is there justification with COVID and with the challenges that we have in filling these positions about going above that and paying a little bit more to try and close the gap on some of those vacancies? That's my first question.
Okay, thank you, Councilmember Rice, for the question. I think that at this point we are rushing to fill our vacancies as quickly as we can, and at the same time dealing with the inevitable kind of churn in positions. We've got a number, and we're trying to do a study on this now to understand what our retirement potential looks like in the county, what our risks are. We have a number of folks who are aging out of who have reached the age of retirement and are retirement eligible, and I expect that will continue. We'll continue to see some attrition and some recruitment. Our challenge at this point isn't a lack of positions, it's just time to fill the ones we have, the vacancies that we have. And I think as we look in FY23, getting back on track to fill those additional vacant positions, to complete those 26 initial positions that council gave us a few years ago is our first goal. I think that as we come out of this pandemic, we will be looking to see whether or not we have actually, that 26 is sufficient, or whether or not we need to grow some more. So I would ask for some patience on that while we look at the FY23 budget, and if there's a need for some additional positions, we would make that request at that time.
Okay, but as far as the actual pay goes for individuals, you don't think that some additional money might make us more competitive and able to fill those positions more quickly?
I'm glad you said that, because you reminded me that one of the things that we're mindful of is that it is recruiting nurses is hard and retaining nurses is hard, and that one of the things that we've done is that we've applied, Public Health Services has applied for a grant from MDH to provide an opportunity to give staff retention bonuses to the staff that are here and with us now. If we are successful in getting that, we will be able to with the county executive's approval, give them a little bit of a thank you for the work that they're doing now. Salary-wise, we are literally taking a look at our salaries on a number of positions. We talked about social work staffing and cost and recruitment a few weeks ago. We're also looking at our nursing to see whether or not we remain competitive in terms of the salaries. So that we should have some answers on in the next few weeks. So I'd be happy to share that with you once we know that.
That would be great. And I'm just speaking as an individual council member, but I know I would definitely be supportive of that. I know that some of my colleagues, including Chair Albornoz, who I'm about to turn it over to, has been very vocal in terms of our continued support to pay these folks who have been working extra hard and on the front lines, as you heard Chair Albornoz say. So certainly please keep us apprised of that. I'll let all of my colleagues speak for themselves in terms of where they stand with that, but I certainly would be supportive. When it comes to, and this is just my last question, strategy around placement of these precious and limited resources, are we basing it on where we're seeing higher case counts? And so I guess this is for you, Dr. Bridgers. Are we seeing and strategically saying that because we have a limit in terms of, we have vacancies, we have other kinds of things, and it doesn't mean that we're not touching every school, but I know that there's only so much time we can spend at each place. Are we prioritizing some of those efforts in some of those areas where we're seeing higher case counts, where we know that we need to do more work?
Sure. Thank you, Councilmember Rice, for that. And yes, we are. We had a phased approach in looking at our assignment. We knew that there were schools, our Title I schools, our farm schools, and in some instances, areas where there were just shortages of either nurses or school health room techs, or if there were at-risk population due to what the data points indicated, where we knew we had more unvaccinated cases, or we saw based on the census tract where they had a tendency to have more exposure rates. And so we based our phased approach on that, also with our rapid testing and where we know we needed to, based on that, based on those data points, where we needed to have more rapid testing done to keep more students in school. So we used a combination thereof in a phased approach. We had a number that we targeted, but we knew that working with the contractors, since as you indicated, the healthcare system, and you as and Council Vice President Albornoz indicated, the healthcare system in general is stressed right now. And so in looking at those spaces to alleviate any stressors, we wanted to use that. We know that our school health services and that staff, and thanks to MCPS staff for supporting some of that, but they were stretched in themselves as well, not only providing the somatic care, but doing rapid testing and doing all of those other things. And so we use all of those variables to factor in a best approach or a best practice, if you will, to have the staffing available, to look at the contractors. We knew that it would be an iterative ramp up, as Dr. Kroll indicated, and he worked with the providers to allow us to get the space in to make sure that any additional contracts were updated. So if we had a lower threshold, we would increase that threshold where that contractor could support us and provide more additional staff. But again, as those contractors look within their respective organizations, they in some instances were somewhat stressed because everybody needed healthcare professionals in other jurisdictions. And so we made our targeting very deliberate. So that was the long answer. The short answer is yes.
Well, Dr. Bridgers, I appreciate that. I'm going to turn to Vice President Albornoz, followed by Councilmember Glass, followed by Councilmember Navarro. Mr. Chair.
Thank you, Mr. Chair. And I want to join Dr. Kroll in wishing my congratulations to Ms. Glick. She and Dr. Kroll and I had the opportunity to serve together on the board of the Collaboration Council together. And I'm intimately familiar with her dedication and leadership for 30 plus outstanding years of service to our community and to our children, youth, and families. So she will be deeply missed, and that's an important position, which I know we'll want to backfill as soon as possible, although her shoes will be difficult to fill. My first couple of questions are administrative questions for you, Mr. DeAndrea. The public health officer position, which I think is a great idea. I'm very excited about that because we've heard feedback from, I didn't get the exact title right, but the health officer position within MCPS is an important position because I think it can serve as a bridge. I've been immensely impressed between the collaboration between MCPS and HHS through the pandemic and through COVID. But some of the feedback I had received prior to this, particularly from some of our school health nurses, was they didn't exactly know where they fit within the school construct. And every principal in every school, has a different style, has a different approach, has a different management approach to some degree. And there wasn't a high degree of consistency. And often I would hear feedback that our school nurses, had feedback that they wanted to provide, had trends that they were seeing. And while there's strong collaboration, weren't always sure exactly where to go with that information. So I'd love if you could to expand a little bit on this particular position and share with you a little bit of feedback that I received actually just an hour before our session from a friend who I encouraged to apply for the job, who I think is very qualified, but actually ended up not applying because they weren't entirely sure of what the job functions were and how it interacted with HHS. So could you talk a little bit more about the vision for the position? And if you could go beyond what's just in the job description, and Dr. Bridgers, I'd love your feedback here too, and Dr. Kroll, but how do you envision this position working in the intersection, not just in terms of how we're addressing COVID and the immediate issues, but coming out of COVID, where the intersection will be with this position and collaboration?
Thank you very much, Vice President Alvarez. The first piece I'll respond to is regarding the title. So this is actually something we had spoken to DHHS and had a good conversation about. And in order to make sure that there wasn't confusion between someone within the school system and someone within the Department of Health and Human Services, we ultimately are referring to the position as a medical officer, a school system medical officer, to differentiate since there's a health officer in the Department of Health and Human Services. In terms of more specifically around the role, part of this I think will evolve over time, but just to give you some key pieces of it, from the strictly MCPS side of things, this person, once they are identified and hired, will take the lead in our MCPS COVID-19 response. And so working with offices throughout the system to coordinate all the work that we are doing, and right now is in a variety of different offices, coordinating all of that work, making sure that it's all aligned, and working with the Office of Communications in terms of how we effectively communicate with our community regarding things pertaining to COVID-19. And so there's a lot of work to go there in terms of that internal coordination. The other piece is the external coordination with primarily the Department of Health and Human Services, but also other agencies throughout Montgomery County. We envision this individual fulfilling a role where they are working very collaboratively with a number of staff in DHHS so that we can make sure that the work that's happening, here at this committee, we have a number of staff from both agencies. We know that there are hundreds of staff that are continually working together on a day-to-day basis at the school level and at the central services level. So how can we take steps to make sure there is seamless collaboration across the board? And as you noted, in terms of questions from school health room staff, what can we do if there are concerns that are coming up or things that would help the process of facilitating that collaboration? How can we work together to put those things in place? So as we hopefully come out of the COVID-19 pandemic, I think there will be ongoing opportunities to enhance our work together at a variety of levels with DHHS. This is a grant-funded position through our federal relief funds. So initially, this position will be funded through fiscal year 24. As we move forward, we will obviously evaluate how the position is functioning and make a determination about next steps. There are a number of school systems throughout the country that do have either health officers or medical officers or something along those lines to have a medical expert on staff. And so we are also consulting with other school districts to get information about how that position functions so that can inform our decision-making process and ultimately the implementation of best practices. Dr. Bridgers, I don't know if there are other things, or Dr. Kroll, that you would want to.
Sure. So thank you. And I'll be brief. I'm glad that we did have a conversation about the medical officer versus the health officer, just so that we keep confusion out of the public, and I think that kind of resolved that issue nicely. I think obviously Mr. D'Andrea talks about the COVID response, and there is a lot of work yet to be done on COVID response. there's also going to be a lot of work to be done on recovery and the trauma that is befallen our students in this last 2 years. But I think beyond that, this is an opportunity for us to have a more coordinated response for disease management with the school systems and for health promotion. We've been talking pre-COVID, we were talking about things like behavioral health and substance use disorders, smoking, et cetera, and overall health of our student population before Dr. Gill's department, long before COVID. And I think this is an opportunity to actually have a more centralized and coordinated effort around that. So I'm looking forward to it.
Sure, and just to add, thank you, Mr. DeAndrea and Dr. Kroll. So the way I look at it is from a community of practice, as if we were operating a community clinic, if you will, and you had two physicians or two doctors conferring, looking at the charting, looking at best practices, as I indicated before in my response to Councilmember Glass. And in my opinion, it's yet another thread in that safety net for the community as we see. And from a collaborative standpoint, if we're looking at data points and we may not see it through one lens and that particular health officer sees it through another lens, we may be able to have more targeting strategies. I know that Councilmember Rice has often talked about drilling down even more from a zip code analysis perspective and looking at that to see if there are any other hotspots. And so from a public health perspective, this is how I see it in collaborating from an HHS public health purview.
And the only other thing that I'll mention is, I know that there have been questions about, how does this relate to the overall relationship between MCPS and the HHS? And I know that we feel very strongly and have had conversations with the HHS that we view this position as a way to further strengthen our relationship. We have a great working relationship with the HHS and collaborate all the time regarding so many different issues regarding COVID-19 and other things. And so we view this position as a way to further strengthen that partnership.
Yeah, I agree. And Dr. Kroll, I could not agree more that this position has tremendous opportunity beyond just somatic health and looking at behavioral health, substance abuse, and the other myriad of issues that are facing our students and are increasing in their level of depth. We've heard feedback from our school nurses that they're seeing behavioral health issues that they hadn't seen before coming into our school health nurse programs. And so we're not going to be able to focus on that aspect of this discussion today, but I do think it's something, and we've already had several conversations about this, but and I suspect if we added that to, if MCPS agrees, to the job description, I think you may find that there would be a stronger pool of candidates who would be more interested in the holistic elements of this position and their potential to address the long-term, health needs of our students beyond just COVID, and acknowledging it's grant funded and we have an immediate crisis before us. But I think you may get a couple more candidates, strong candidates, if you expanded that a little bit and described authentically that was part of the approach. Just a couple of other questions. The obviously cultural competency across the board in all sectors has never been more important. And I'm just curious as to the contracts that we have in place with the nurses that we're bringing on board to expand on the work of our school health nurses who are trained and go through exhaustive background education, especially on cultural competency. Is that part of the contract? Is that part of the training for the school health nurses that we're hiring on a temporary basis to get us through this extraordinarily difficult time? Is that part of the deal?
So our standard contracts now talk about linguistic diversity in recruitment for all of our temporary staff and support staff. So yes, anticipating a question, I can't tell you what the numbers look like now in terms of language and diversity. The priority obviously was to make sure that we had people who are able to do injections, to do blood pressure, to do those kinds of things. And then we have, between MCPS's interpretation and translation services and our own services capacity when we need that to arrange for translation and interpretation. I think the challenge for us as we go forward is obvious. Nursing is a specialty, and the numbers of available nurses are low. So we're always trying to figure out how do we bring folks in who have the skills and the cultural competency we need in the county, and the health skills that we need as well for our suites and for our healthcare settings. We are continuously working on it.
Yeah, no, I feel you, and I know you are, but I know it's a priority and remains a priority, but as we all know, the urgency is pretty significant.
I would also say, just to say, I would also, we've talked about diversity and recruitment, and we're continuing to work down plans and work on processes for how we grow our pipeline from within our county. That's obviously a long-term ramp to get people on board who can do the work, but school health room techs represent a potential entry for some of that as we go forward.
Vice President Alvarez, just to add to what Dr. Kroll indicated, I know that in not only our recruitment, but our placement, we know that we have a very diverse community, and looking at our settings and looking at the community, we take all of those cultural much needed competencies into consideration and try to identify staff, be it based on language, diversity, and or needs in the various spaces that we have, not only our staff assigned, but try to recruit and align those staff as such. And so we've taken a lot of time into doing that in consideration in our staffing program. Sometimes on the front end, it may take a little longer, but on the back end, it's time well spent, because we know we have the diversity and the competency in our areas where we have staff assigned.
Last question for now, and then I'll yield back to you, Mr. Chairman, and this is going to be an oversimplified question to, I know, what is a much more complex issue, but when a teacher is out, we call a substitute to come in. We don't have a strong pool to begin with, and when God forbid, there's a school health nurse that can't come in because they are sick, or if at some point during the course of the school day, they become overwhelmed with the number of cases that they're seeing come in. How do we handle that when workflow, for whatever reason, rises to a certain level where there's concern by those who are on the ground that their ability to be able to provide the care that they would like has been compromised for some reason? How do we address situations like that?
So, Council Vice President Alvarez, Ms. Glick and her team of school health managers continuously assess the need. They have a cadre, a pool of substitute nurses, if you will. But if something happens during the day, they often step in and fill the void. That's the unfortunately proverbial nature of this beast right now. We're looking at strategies to build upon that. They look at our contracted nurses as I indicated, our phased approach. So they've embedded some protective measures to allow them to be mobile, if you will, to be able to move from various school settings if the need arises, either in the morning, during the middle of the day, or even in the afternoon. So that's been the strategy thus far. We continue to try to refine that. And as we continue to onboard staff, to not only give them the particular training during the onboarding and orientation process, to be able to assess their availability to be flexible.
Okay. So there's a system in place coordinated by Ms. Glick. It's already pretty stretched as it is, but it's the best we've got right now, under the circumstances. And
we're building upon that, knowing the challenges that we have now, the retention and attrition rates. But with our contractor pool, we have 3 contractors. We've brought them in to do clinical support and also non-clinical support. And so we're looking at being able to diversify that and be able to have some of those spaces, even if it's just to support some of the non-clinical needs. And so Ms. Glick and her team of nurse managers do this on a daily basis as part of their school assignment planning.
Okay. Mm-hmm. Thank you. I may have a couple more questions, but that's it for now. Yield back to you, Mr. Chairman.
Thank you very much. And those are all great questions. This is really, really good discussion. So let me turn to Councilmember Glass.
Thank you very much. Yes, and very good conversation. I appreciate the chairs for organizing it and for everybody else for this update. I have a few different questions that really fall into 2 different buckets. One, it is helping inform parents about the COVID vaccinations, which are underway, which is awesome. And then going back to some of the administrative personnel issues that Vice President Albornoz was getting to in his good questions too. So, as I said, the vaccinations are underway, which is totally great. And I know we've all been posting on social media and spreading the word. And people were so excited and ready and anxious to get their children vaccinated that the county system crashed yesterday, which just shows how much interest there is, right? We got to work on the IT. So for the sake of this conversation, I will ask that question now and we can come back to it, but curious about how that functionality is going to work moving forward. But as it relates more specifically to even MCPS, I know that when we had our update earlier this week, there were a few pieces of information that we were told that parents should expect. And one of them was about some guidelines, and I'm not sure that those guidelines have been sent out. And then the other aspect, parents were asking me about the coordination with the schools. Or actually, people were saying that we should have the vaccination sites in schools or coordinated. And I said, yes, that's coming. Go online. And some people saw some information and then that information seemed to have disappeared. And so I know I've asked a series of questions here, but I just wanted to get it all out because it highlights some of the confusion that is out there. And I view this important conversation as helping those who are listening and those who will be sharing this news.
So, good afternoon, Councilmember Glass. I will start and others will chime in.
It was a jump ball. Didn't quite know who to go
and I grabbed it. You know me, I'm always an opportunity to grab it. So PrepMod is a state system and we've had challenges with PrepMod for the past 20 months, to be quite frank. So our team, our IT team and our web site team have reached out to state, and PrepMod is a state system that allows for appointments. And so the system crashed in a sense that it wouldn't give any indication that there were no more appointments available. And so we worked last evening and today, hopefully the situation has been resolved. We reached out to state so that a notice will be given when no more appointments are available. We know demand will be challenging for the first 3 weeks of our vaccination strategy. And so we not only have messages posted on our website, or should be posted this afternoon, that if you get a message that try back later or, no appointments available, that it be very clear that there are no more appointments available. To continue to check the website throughout the day to not only list our local health department, HHS sites, but also the other providers who have access to follow up to see if they're offering vaccines to the general public. And so they will have an appointment schedule as well. We have our MoCo GoVax website. We have the information on our county portal, and the state has the information as well. But absent of the state, we want to make sure the message is clear that if there are no appointments available, we want folks to know that there are no more appointments available and not to check back at another time. And so we worked very hard last night and today to have that messaging with our website, webmasters, if you will, and hopefully that will be a clear message. We know that many of the clinics that we have now aren't high dose clinics, which we typically saw 15 to 2,000 doses a day. These will be less than 1,000 doses a day, which is based on the demand or lack thereof of having available doses. And so we want to keep the message clear. We want our countyans to look throughout the county, inclusive at those other sites where vaccines may be available. And we will continue to work and request more vaccines and make the message clear.
So thank you for answering the questions regarding the website and the functionality of that. I said it was a jump ball. Now I'll switch to a different, sports figure and quote Yogi Berra by saying this is deja vu all over again from when we started with the vaccines. And I appreciate you re-upping the fact that it is a state site and we did not have the ability to create our own when I know probably all of us wanted to do that early on. So again, thank you for helping level set and allow others to understand the situation that we are in. So yeah, Dr. Kroll.
Before you go to the next jump ball, I wanted to say I just did a quick check to see to look at our website really quickly, and our website does contain the list of available sites and places where an appointment can be made, where people can get their vaccinations for their children. So I just looked it up, and
log on now for everyone.
I don't know if that means that there are vaccinations slots available, but it's there and it's up through, I think, looks like through the 8th. So
good. Okay. Next few days, great. So, so thank you for that. That is again encouraging and also level setting for everybody. And then, so Mr. DeAndrea, I guess I would defer to you to answer maybe some of the MCPS information questions.
So I just double checked with our communications office. So the media advisory with the information has gone out. The information that's going out to the community is going out this afternoon. So that will have the updates. So as I shared at the full county council briefing on Tuesday, we had shared some information on Monday, got additional clarification from the state on Tuesday, which for some revisions in what was shared on Monday. And so that updated information will be going out, and that which goes into effect on Monday will be what has significant impact on overall quarantine numbers.
Excellent. I'm glad to hear that. Again, I know I can speak for my colleagues and from county officials that the information that you help provide in a direct way will help save us some emails and some responses as well. So I'm glad you checked in real time. Thank you for that. And then so that's all I had for the immediate bucket. But the second bucket of questions was about the personnel and kind of picking up the ball that Vice President Albornoz was playing with earlier before about the school health officer. I heard you saying, and Mr. DeAndrea, I heard you saying that the first round of job applicants weren't satisfactory or didn't meet expectations, and that it's being reopened. Continuing the line of thought from Vice President Albornoz regarding the chief health officer for the county, is there a way to piggyback off that job application process and to see whoever has applied there and send out, basically an interest letter to see if they'd be interested in working with MCPS?
That's an interesting question. We had this conversation with MCPS last week about that position, and there's a contractual issue around that, in that we used a search firm to search for a particular set of doctors for a particular position, for our health officer position. I'm not clear, and I haven't gotten a read back from our attorneys yet about whether or not we could share that information, that list of doctors with MCPS for another position that's separate from the one that we contracted for them to hunt for. So if that's possible, yes, we would share that information gladly.
Good. Well, I'm glad you have already looked into that. Having done some job searches as the employer, when you hire those firms, you own, right, the process, or you own the product, which is the resumes and the candidates. And so I would hope, we'll leave it up to legal interpretation, but I would hope all the resumes that come in are ours to do with what we want. And I would encourage us to send an email to those folks to say, hey, we have another job over here that you might be interested in. So, and then the last question I have regarding jobs, it was said that there's a shortage of nurses and techs, and we know this is a national situation, and we've discussed this here. We've discussed it at full council, and so appreciate the update there. But one of the things that we all have been talking about for a very long time are also clinical licensed social workers. And this joint committee earlier on in the year had a very robust conversation. The community has had a robust conversation about clinical licensed social workers being in our schools, and now that kids are back in school. I think I had seen some statement from Dr. McKnight about some grant opportunities. Can you share with us where we are in making sure that our children have adequate mental health support now that they are back in school?
Absolutely. As part of our ESSER 3 grant application for some of our federal relief funds, we had put in one piece in there to be able to hire additional social workers and counselors. And so when that funding ultimately got approved in the last 2 weeks, we are then making determinations about the best next steps. So for example, for the counselors, those we have advertised to our usual processes. Unfortunately, like with so many other positions, we've had a very difficult time identifying candidates for those positions. For the social workers that we had identified, we have had conversations and reached out to the HHS to brainstorm the best path moving forward, and we're still working out some details there because we know that there are a very limited pool of social workers and even more limited pool of licensed clinical social workers. And so we've been discussing what are our best options for this school year, and then saying that, ultimately we'll have the funding for next school year. We know we have it now, so we can move forward at a time when there's typically more transition among staff in schools and hopefully recruit from other school systems in other areas, in the spring and in the summer. So the goal is to move as quickly as possible to get additional mental health supports in schools. And so we're working to determine what the best path forward is there to get those.
Okay, so I'm not sure I understood the timeline correctly. I heard you say that by next academic school year, they should be put in place, but we're not quite sure if they'll be available for this school year.
Just to clarify that, I was just saying that for next school year, we had always intended this year to look at possible contractual sources of social workers as a way to fill more quickly the positions. And then as we move into the upcoming school year, be able to advertise to our usual processes and hire as permanent MCPS employees. So I apologize for the confusion there. We, based on the work that we have done, leading up to this, we realized that even trying to get social workers through a contractual agency is much more challenging at this time. And so we've had some preliminary conversations with the HHS about the best path forward for mental health support and be able to use that funding. It may not be specifically social workers in the interim, but that our goal is definitely to have additional social workers in schools. And I think we will be able to get some. I think that in the grant proposal, we put in 50. I think that's going to be challenging, recognizing that whether it's we solicit through MCPS or use a contractual agency, there's not a large pool of social workers available.
Again, getting back to the shortage in the healthcare sector, I know that to be true. Dr. Kroll, I see your hand is up.
Yeah, thank you. The one thing I would add to this, a little bit of insider baseball, but or basketball, just to stay with your metaphors. But it is one of the conversations we've had with MCPS and Mr. D'Andrea is about the function you want, because social worker is such a generic term. People say social worker when they mean mental health, when they mean case management, when they mean just a consultant to talk with you. A licensed social worker is a very specialized and rare bird, but everything that we might need to do and that the school system might need to do doesn't necessarily require that level of a social worker. So the question is, what are the functions that we're trying to fill, and what level of professional do we need to fill those functions? And that's part of the conversation we're having, and willing to support however we can with our available avenues for recruiting temporary staff until we can help them get permanently staffed up.
Sure. And so I appreciate that. And so I'll close on this. What you just said, Dr. Kroll, and what Mr. D'Andrea said, they are both true, right? That there are differences in the level of education and the level of work or the type of work that a social worker can do. And there happens to be a shortage of professionals in the healthcare sector affecting all different types of roles. But it is also true that we all have agreed that we need to do this. And we've been talking for about a long time. And I know my colleagues, especially colleagues on this members of this joint committee have been doing various types of work as well. And so I just want to underscore where we are and where we need to go and continue working through all of this, and whether we start planning for FY22 budget to make sure that we correct what wasn't there last time, or exhaust the federal support or any other types of grant or philanthropic support that might be out there. But we're committed to doing this, and we need to get this done. So in general, thank you all for this update. Thank you for the future communication that MCPS will be providing parents, and look forward to working with you on all of these issues. And with that, I yield back, Mr. Chair.
Thank you very much, Councilmember Glass. Councilmember Navarro.
Thank you, Mr. Chairman. Thank you so much for all the partners for this update. So I wanted to sort of organize for myself, just kind of figure out the kind of priorities, I guess, what's in front of us and where do we need to go from here. So no doubt that the conversation around mental health professionals, culturally proficient, linguistically proficient, it's something that we have definitely been talking about for a long time, dating back when Councilmember Leventhal was the chair of the HHS committee. And one of the reasons why, and I know Councilmember Rice will remember this, one of the reasons why we ended up funding outside of the budget that came from the executive back then, the wellness centers. And one of the reasons why we also added school nurses and things of that nature, because we have been tracking gaps for quite a while. And so that is there as just kind of like history for us to understand the context where we are now. So as I'm listening to the presentation, it seems to me that we have literally like one very urgent task to address, which is the vaccination of our youngest, of our children. To me, that is like priority right now, while we're then exploring and putting in place very aggressive strategies to figure out what can we do differently to then retain and also recruit additional healthcare professionals as well as mental health professionals. So I see two tracks, and I'm trying to then understand with the first track, which is the most urgent piece here that is now here, which is the vaccination of our youngest. One of the things I asked for during our Tuesday briefing was just for me to have an understanding of how are we transferring the strategy that we put in place for our overall vaccination process, which was very successful, right? It took a while for us to kind of get all the pieces in place and get everybody involved, et cetera. But it was such a good, grassroots organizational and government partnership that yielded extraordinary results. So thinking about the fact that that was a much larger undertaking, but narrowing it down to our young people, notwithstanding, I think my internet says it might be unstable, so I'm going to turn off my camera in case you can hear me. So I would just want to understand if, how far are we in terms of incorporating all of those partners, all of those strategies, given that we're pretty much done with the adult population. How are we shifting all of that once and for all to our young people? That is number one. And I did see in the presentation that there was a list of the partners. I do think Por Nuestra Salud is misspelled, so that may want to correct that. But I'm wondering, so where are we with transferring literally that template that served us so well into now dealing with our young people and vaccinations, and given that it's here, right? So we've been there, done that. We've seen this movie before, but we succeeded. What are we, where are we in terms of that process? That would be my first question. And then my second question is, when will we see the county council, et cetera, when will we see a kind of robust, targeted proposal to get us as a jurisdiction ahead of the curve with this challenge of our mental health professionals as well as our healthcare professionals? Because every jurisdiction is dealing with this, and it's kind of like a competition. And so I heard Dr. Kroll talk about maybe some money coming from the state for maybe some bonuses or something like that. But what other things are you working on that would give us an edge to get ahead of this challenge? Because again, it's definitely a regional challenge, and we gotta be pretty aggressive And so that's, to me, that's sort of like the track two, kind of like what we need in order to stabilize the needs out there, the mental health challenges that we're seeing with our young people. And it's kind of like, I think, the long-term strategy and action plan around these needs that are not going to go away. So I'm just wondering, in terms of those two tracks, the more urgent one, and then sort of like, present, but then also looking ahead to once and for all, as Councilmember Glass was saying, because we have been addressing, dealing with this for a while. Once and for all, we can start having some metrics and then benchmarking ourselves to see how successful we've been.
So I will ask Dr. Bridges to talk a little bit about the in more detail about the priority one that you talked about. But I will say that as you look at what we've been doing and working on, and I think we reported this to Council at Board of Health over the last week with Sean O'Donnell, I think, the plan that we have put in place from start uses and takes advantage of all of the resources that we put together in the first 10 months of this year, first half of this year to get this done. Salud, the AHP, the Asian American Health Initiative, all those partners that have been out there vaccinating in the first half of this were invited back to the table. And so they're participating in various ways. One of the differences around this is that not all of them had capacity to vaccinate at the pediatric population. That's a specialty area. And so the ones that did have that, we are working with to work with them, to partner with them to get them into that mix as well as we can. And at the same time we're doing that, we are still working to get first and second doses and boosters in for their parents at the same time. So as this unfolds, you'll see all of the lessons that we have learned and some things we thought of since then coming into play. I'm actually pleased with what we've done to this point in terms of the planning process. I do not think that the plan is going to survive its first contact with reality, because no plan ever does, but the team has demonstrated an ability to adapt and react. And I think that will continue. They will continue to do that throughout this process, as they have done for the last 20 months or so. James can talk a little bit more about those details as needed. But on the second issue, you and I and other members of the council have been talking about this issue of resources and capacity in behavioral health and in health in general since well before the pandemic, and since I took this job. The behavioral health piece, as you know, we started talking about diversity and recruitment in the workforce before pandemic. Pandemic slowed that down, obviously, but we have not stopped thinking about it and stopped working on it. In fact, we are looking now at putting together our task force per council's guidance on this at our last session on this, to make sure that we're creating a pipeline that draws on the diversity of Montgomery County, using Salud and using as a model, and using some of the work that Montgomery College is doing to try to bring folks from high school into college, and from college into jobs, and from jobs along a professional career track that ends up with them in a healthcare field. From my perspective, hopefully behavioral health for a good number of them. Rather selfishly on my part, I will admit. But I think that so there is. We are working towards that. I won't say that we've got a target set of numbers yet, but I know what the large brush strokes of that are for us, is to put together a plan that actually identifies students and helps them make the decision to come into healthcare, into behavioral health, and then to help them matriculate through a field of study that ends up at whatever level they feel comfortable with. We've had some conversations. We started this conversation with council related to health and human services, but we very quickly are broadening out to talk to our private provider colleagues and hospitals about what they might do and be interested in doing along the same path as well. Rekindling Salud, welcome back. I'm sorry, blocked for a second. Rekindling welcome back, but also figuring out how we expand it beyond nursing to more behavioral health providers. And then the last thing I will say on this issue of social work, I think we mentioned a few weeks ago that our recruitment efforts for social work have been really challenging this year. They're just not responding to our advertisements for positions. So what we've done is with Office of Human Resources, taking a look at our salary grades and looking at what we're paying social workers and whether or not we can increase that, what we're paying folks as starting salaries. So hopefully, once that piece of work is done, we will be able to re-advertise and offer folks some greater incentive to come and work with us in the county. I'll stop there.
Before Dr. Bridgers responds, I just want to thank you, Dr. Kroll. I wanted to give you an opportunity to describe all of that, because I think that there is a bit of anxiety, of course, in our community, given the fact that now we are going to engage in this, new, very important task of vaccinating our youngest. And I think it's important for the community to know that we do have assets in place and that we are leveraging those assets, that we learned a lot of lessons. And that is why we were able to reach the extraordinary milestones that we reached. So I hope that this also is an opportunity for folks to know and hear that those assets, that capacity is going to absolutely be leveraged. The second piece, before I turn to Dr. Bridgers, is that I also think that, we should hear on the council, and I guess take this message back to the executive. I think that we need to, during this next budget specifically, put in place some demands to our, WorkSource Montgomery, to the partners that we worked on and with for quite a while to get these initiatives off the ground, because we've had the conversations, we have examined this, we've had hearings about it, we've had sessions about it. I think it's now time to say, hey, this needs to be a priority, right? Like this notion of how we grow our own in terms of mental health professionals, in terms of healthcare professionals, needs to be a priority for our economic development corporation, needs to be a priority for WorkSource Montgomery, needs to be a priority for our institutions of higher learning, and we should identify some funding to start putting forth some incentives. I think that the time of talking about it has passed. And we don't have a choice but to make sure that, hey, by next year, this budget should include a robust initiative that can start now, but most certainly it should be part of our budget process. And let's just get it going, because this is definitely something that is going to have a long-term effect on us if we don't get creative and targeted and strategic right away and put some money behind it so we can get it going. So I just wanted to take the opportunity to kind of plant that flag as a decisive moment and an action point for us. And hopefully my colleagues would agree that it's time to move forward with something substantive. Dr. Bridgers.
Sure. Thank you, Councilmember Navarro. And to use Councilmember Glass's analogy, thanks, Dr. Kroll. Thanks, Coach, for putting me in. Couple of things, lessons learned over the past 20 months, and every day, Councilmember Navarro, I do a self-assessment to see if we could do things better, to look at our community, to see where we've gone. Before we had, when we got the first few vaccines and even test kits, there was a digital divide. We had folks who had more access, some folks who didn't have any access, and so the question came up on the Board of Health discussion that we had a couple of weeks ago as far as having a pre-registration portal. And right now we have access to vaccines. They're just being distributed in a different manner. We know those individuals have primary care physicians, and we know there are individuals who don't have any primary care physicians or pediatricians. And so we've worked very hard with MCPS to look at those spaces, looking at the data, looking at the zip code analysis, to look at those spaces where we knew we had lower vaccination rates, higher cases of COVID-19, but not only as an individual, but at a family systems measure, because we know that the kids are often, children are often impacted by our family members. And so we looked at all of those data points where we are and looking at the system, and, demand is a key variable that we continue to look at, but we work around that. But case in point, in listening intuitively to you about cultural relevancy, appropriateness, literacy, we've worked very hard with our provider to have access to vaccines. We know that there's some providers who can administer vaccines, but may not have the infrastructure or the capacity or even the system to get a PIN number to get the vaccines directly from Immunet. We've had trainings with our safety net providers, and we've created some space allocations for them because we know that as a community, we need all of us to be supportive of the efforts, as you indicated in our first priority, to get our 5 to 11-year-old vaccinated. We talked to our Maryland Department of Health partners, and we know that in times past, during the mobile strike teams, they deployed individuals who had white vans or vans with markings on it. And in some community, that's a red flag. You know, we've asked them not to wear uniforms. And we know that when we went to Middlebrook Gardens and they had vans, that was a very challenge in the community. And so we've had assessments with our teams. We want to make sure that they remain aware and in tune with our community. One of Dr. Kroll and I were in a town hall session, and one of my previous professors at the University of Maryland School of Public Health, Dr. Olivia Carter-Porkis, talked about respect and trust. And so all of the lessons learned over the past 20 months, we continue to ensure that these places, our spaces, are not only respectful to our countyans and our citizens, but they're trustworthy places where we know folks can bring their children. We've deployed clinical training and settings and technical assistance to those providers who support us. They may be in settings such as elementary schools in times that we aren't there. And so we've worked very diligently with our MCPS partners to gain access for those individuals to be able to go in these spaces. We know that we have shelters where we have pediatric or school-age kids who for whatever reason it may be, need access to vaccines. So we're working with our community partners to provide access to them in shelters, which is another space that we may not have thought about maybe 20 months ago, but it's a much needed space where we need to vaccinate our 5 to 11-year-olds. And then we think about other places like those individuals who are at home because they have chronic illnesses and who may be immunocompromised and may not be able to attend school because it's a higher risk for them that we may not, at a superficial level, may not understand or even know about their personal health challenges. And so we've created spaces and had conversations with our community partners to support this pediatric cohort as well. So when we look at all of the 5 to 11-year-olds, it's not just those individuals who are in spaces where there may be lower vaccination rates or we haven't gotten there. We want them to be accessible via transportation, accessible to their parents. We've also created spaces, which we didn't do before, where we know that if their parents and or siblings or family members, whomever they may be, they can come with their children to get a vaccine or booster if necessary. So we've worked with our MCPS partners and our community partners to not only provide pediatric vaccines there, but also those much needed boosters and additional shots, if you will, for immunocompromised individuals who may not have any other opportunity to get a booster or a vaccine during their normal business day, work day, family routines, etc. So we want to increase access. So when we look at access, we look at the larger picture of making it accessible for even those individuals who now have taken time out of their daily routine, family routines to take their 5 to 11-year-old child or children to get vaccinated, but they themselves can also get an additional shot if they so desire, or if they haven't received one through any settings due to other obligations and responsibility. It could be work, it could be any other settings, but we made it available. And so when we continue to build our playbook, build our capacity, and build our infrastructure, all these things come to mind as we look at our places to be more transparent, more accessible, more trustworthy, and more respectable. I can go on all afternoon, but I'll stop there.
Thank you.
Well, thank you very much. And I'm going to turn to Councilmember Jawando. I just want to make an announcement because I took Dr. Kroll's advice. I always try to do that. And I went online on PrepMod And I can tell parents right now who may be watching, and so I'm leading in like I normally do with Councilmember Jawando for the millions that are watching at home. If you are a parent, I encourage you to go on Walgreens website. They have a number of appointments that are available for 5 to 11. In fact, I see at their University Boulevard location on Wednesday, November 17th, they've got 33 appointments available. Now, I know that's 13 days from now, but you do have the opportunity, and there are a multitude of other sites throughout the county that do have appointments available. There are others as well. I just happened to click on that through the PrepMod system, and Walgreens was the first one that came up. So between CVS and Safeway and all the other providers, Giant Food, all the others that are out there, they do have this Pfizer vaccine, and I encourage you to just take a look and see when you can schedule an appointment that is convenient for you, both location-wise and time-wise, and avail yourself of some of those opportunities that are out there. So there are opportunities out there. And so with that, let me turn to Councilmember Jawando.
Thanks for the lead in, as always, my friend. I appreciate that. I'm glad to go last because a lot has been said, and I associate myself with the comments of my colleagues. And just wanted to highlight a couple things and then ask one question. Absolutely, Councilmember Navarro want to double down the pipeline, and she's, I think, the longest serving member of the council, despite how young she is. I know this deja vu for her. I've got deja vu on this issue. And we have to, and I know we all want to, but it has to be, we want to put in the budget something to fund a plan to grow our own of all these types of mental health professionals across, and it has to be everybody, MC, USG, MCPS, HHS, the private sector, the county. Couldn't agree more, and just wanted to talk about that. And I know some of that work is going. I know USG has a great nursing program, right, that we need, and we're trying to ramp that up. But absolutely, we have to have that as part of a strategy. It's obviously a national shortage, national issue, but I do think because of where we are, we're well positioned to have a strategy to attract people more so than some other places. And so whether it's compensation or our credentialing or whatever the range of things are, we want to make sure that we're supporting the efforts to do that. The other thing, just picking up with something Councilmember Glass said, and I think you responded, Dr. Kroll, the other types of professionals, there's 800,000, I don't know, I think it was 700,000 a couple of years ago, but I'm sure it's a little more now, social workers in the nation, right? But they're in the social work field, the therapists, the counselors, the substance abuse professionals, there's a big range. And, when we're talking about our kids, for example, there's a lot who could benefit from, someone who doesn't have the full licensed clinical social worker, but is one of these other levels, or is even learning to be, is student teaching, for lack of a better word, kind of the year in classroom. And the need is so great. I would love to hear what we're doing or what we can do or be a part of our strategy to to use the analogy we've all been using, flood the zone with those lower level or those entry level, to really take some of the needs that can be met at that level and reduce the pressure on the licensed clinical social worker or the school psychologist. And I know it's not a epiphany. I'm sure you would agree, and you're like, we're doing that, but I just would like to hear, are there things we can do there where it seems where you can get people going a little quicker to help with that? So let me pause with that. And then, actually, I'll just ask my last question. The nurse to student ratio, I know it was 1 to 1,800 or so. Where are we on that? And, have we made progress? I know we've made some in the time of this council, thanks to Councilmember Alvarez and all of us supporting those efforts. Where are we on that? And then if you could answer the second part of my question on flooding the zone with the other types of professionals.
Okay. So I'm going to defer to Dr. Bridges. I don't know where we are in terms of the ratio at this point. I know what our target is 1 to 850. I want to say that's right.
No, that's correct. That's correct. 1 to 850, and we're working on it. Good afternoon, Councilmember Jawando. We're working on it. quite frankly, we aren't there yet. We've been working with our Office of Human Resources to look at those particular strategies you talked about from the social workers and the other behavioral health specialists, but we're also looking at those clinical spaces as well. So, for example, if by Cohort regulation and by state regulations that we could bring in a nurse or a nurse tech, a school health room tech that has an associate degree, as opposed to someone who has a 4-year, who is a licensed practical clinical nurse or a registered nurse. So we've gone through all of the categories to see, as you indicated, where we could begin, at the entry level, if you will, and then build up upon that to get that ratio up. But right now it's currently 1 to 850 students, and so we're working on that.
That's the current ratio, or that's the goal? That's what it is.
No,
right
that's the current ratio that we have. Ratios were initially reviewed by the county executive, and it agreed that the nurse. And I'm just reading from the notes that I have here. They vary, but it's estimated to be 4 to 5 schools over 850 students. So we still have a ways to go. We still have a ways to go.
So I would.
You were going to address the other point, I think.
Oh, yeah, a little bit more about this, and then the other point. The other one is that the ratio that we talked about those things were all discussed and set pre-COVID. I think that given where we are, and given what my experience with disasters, and notably the aftermath of Katrina, and how long-term the impacts of that have been, I think that we need to revisit those issues and those numbers and those demands. Clearly, our nursing staff are telling us that they're seeing a heck of a lot more than they had been seeing in past years. And I expect that's going to continue. So we need to revisit those numbers, I think, as we go forward. Regarding the staffing pipeline, if you will, I mentioned at the start of the hour that we were looking at. We have a whole series of school health room technicians that we now need to look at as entry-level positions into our school healthcare system, and figure out how do we invite people to come and play in that space with us. In the rest of HHS, we have community service aides and community support aides and a variety of behavioral health technicians that are also often for us entry-level positions into the behavioral health world. They go from BA, bachelor's level behavioral health technician, to a master's level behavioral health technician, to then a therapist 1 or a therapist 2. So there's a pipeline that is, for my money, crude at this point. And I think there's some ways to smooth that out. And that's part of what I was referencing and talking with Councilmember Navarro is building that pipeline, and figuring out how we tie to both MCPS graduating seniors, but also students at Montgomery College, to identify those folks in the community and bring them on board. And then the last thing, and I'll stop, is that the piece that I didn't talk about earlier was that we need to look at how do we incentivize folks to come and work with us who have finished their degrees. The cost of a graduate degree now is through the roof, is astronomical, and you need to get paid well to justify doing it. So getting a social work degree that may cost you $90,000 isn't worth it if you can't make a decent salary enough to be able to live comfortably, reap the benefits of your education, and pay off your loans. So we may need to think about how do we offer tuition assistance or offer loan repayment in exchange for years of public service in the county. So those are some of the things that that are on the table for us to discuss, and likely with our partners develop some options.
That's a great thing. There was just, when I worked, I'll let you go. When I worked on the Hill, I worked on the bill that created public service loan forgiveness, and it's been a disaster that's just now being started to work for people. But you had to do 10 years, and they forgave and make payments for 10 years, and you got everything else forgiven. I think those types of programs for this field and others for us, it's a little different because we're not forgiving. It's more of a repayment kind of thing, but we'll pay towards it. I think those are ideas that I think for absolutely are things we need to look at. So I'm glad you're thinking about it, and look forward to discussing that and more. Appreciate it. Thank you. Thank you, Mr. Chairman. I know it's been long. Thank you for everyone's work.
No, thank you very much, Councilmember Joando. I'm going to turn to Chair Albanose for some closing things, and then I want to try and wrap up some of the asks that I think I've heard from many of you. And also recommend a follow-up for us as a joint committee. So, Chair Albanose.
Thank you very much, Mr. Chair. I think this has been a robust discussion, and I look forward to the summary that Councilmember Rice provides. And I'm sure we're on the same page, but I was keeping a running list as well. And there is definitely follow-up necessary. I think there's some real opportunities, particularly around visioning on how we might be able to more proactively address some of these health needs of our students, but also the faculty and staff themselves. To see what more we can do to provide support for them. And once we do have this medical officer position in place, the synergy between, better understanding that synergy, I think is going to be critical moving forward. So I look forward to the ongoing discussion and appreciate what everybody has contributed this afternoon.
Thank you very much, Mr. Vice President and Co-Chair. And so let me just work backwards, if I may, and start with one of the things that you said. I know that I have a meeting with the county executive following this meeting this afternoon, and we'll be bringing up a conversation that we've had about social and emotional learning and what we need to do for our kids, as well as for staff. And so a lot of that and the mental health and things that go along with what it is that we're talking about our children also needs to be lifted up for those staff who are providing the support, who oftentimes feel overwhelmed. And so from that perspective, more we can do there is incredibly important. We heard about growing the cohort. We heard that from Councilmember Navarro. We heard that reiterated by Councilmember Glass and Navarro in terms of how we need to continue to grow that cohort and make sure that it's diverse. And so working and trying to do things that are creative, including scholarship programs. I know at the state level, we've done that for a number of different pathways. We did it with in reference to our teacher shortage. And there are things on the books regarding things that you can do for signing up to be a teacher and getting scholarship money as long as you commit to working within the state. Those are things that we need to work with our state partners on. And so and there are a number of them that are like this that I think that we as a group need to come back as a joint committee before we go on council recess. And the reason why I'd like to do that is because Dr. Kroll, you had said you'll find out in about 2 or 3 weeks about the grant status for some of those additional funding options that may be there to help lift up the salaries. We need to get a better picture of what that is and also what some of those numbers are. I know we didn't have all of the numbers today, but I'd really like to get to where we can look at those cohorts of the number of counselors to students, those ratios, so that as we prepare for the county executive's budget and as we prepare for what's going to happen in Annapolis in terms of us asking for additional support, we'll be prepared by having all of that information and know exactly level set where we stand as a county. I will add that with Build Back Better, it does have mental health supports as a part of it currently under the current drafted bill. And I was talking with Senator Van Hollen about this yesterday and some of the child tax credits and other kinds of things that are there. The reality is we want to leverage as much of that as possible also. And so certainly working together with our federal partners and making sure that some of that money that we might be able to then utilize to help offset to be able to pay for some of the down payments we're going to make in terms of ensuring that our children are healthier is just incredibly important. And then, of course, when it comes to placement, Dr. Bridgers, you heard this from Councilmember Navarro, you heard it from Councilmember Glass as well. If we could start to get an idea of where, right? So for our next meeting and looking at the charts and seeing where we're actually getting that. We talked about it today in general terms in terms of being strategic about those places, but I'd actually like to see it and see the data that's there. I know that my colleagues would as well. It will help us in terms of really identifying and making sure that we understand how best we're utilizing our resources and where those resources are going. Mr. Chair, let me ask you, have I missed anything from what's on your list?
Nope, and in fact, you added several, so thank you. I concur with the timing.
Excellent. All right, terrific. Yeah, so what we'll do is we'll ask again. So this isn't something that's like, oh, you have to do this tomorrow. I do think that we do want to have another meeting scheduled just before we go on recess. That would be terrific because it'll give us an opportunity to help guide the county executive with what we hope he'll put in his budget, as well as allow us to prepare for what it is we'll be asking for our partners in Annapolis. And Dr. Kroll, if you can, you don't have to wait on the status of the grant request if you could just let Ms. McGuire know the status of that. That would be terrific and keep us apprised of what's continuing to go on in that realm. But yes, please.
Just want to add, since we have everyone here, I meant to say this and I forgot. On the other thing with the lower level social work fields is if we could get some sort of survey or assessment on the MCPS side, particularly with our students, of what are the range of like needs as we're reevaluating our ratios. To your point, Dr. Kroll, how much could be, we're never going to get precise, but I think we could survey and get a good sense of, based on what people are presenting with, what level of person is required for X percent of cases, if that makes sense. And I don't know if we're assessing that or whatever, how many people are coming in with something that could be dealt with, and again, it's no perfect fit, but a therapist could deal with, as opposed to having a licensed clinical social worker. If there's a way for us to, in fact, get that information, I think it would be helpful. So I just wanted to add that, Mr. Chairman.
Well, no, and Councilmember Tawando, I think that our YRBSS, our Youth Risk and Behavioral Survey, that we already do. Now, I don't know if we did that in 2020, Mr. DeAndrea, because of COVID. I know that we have 2019 data. I don't know if we have 2020 data for that.
I don't believe that we conducted that survey in
right.
2020.
So if we could, right, and so this isn't something that would have to be like the before December 1, but I do think that we do need to talk about the reinstitution of that YRBS survey, because I think that would give us exactly what Councilmember Tawando is talking about, and give us an opportunity to look at a myriad of the other issues that Dr. Kroll is referencing too, when it comes to just understanding that we have a different kind of child that's presenting different kinds of issues at this point, and that survey does give us the ability to capture that information.
If I might add, that survey is restarting this fall. I'm not sure of the exact timeline, but it is definitely happening this fall.
Excellent. Fantastic. So great. So Councilmember Tawando, to your point, that will be there, and we'll make sure that we utilize that data that'll help us to inform. It won't be ready for a December meeting, but certainly one that we can address in the spring. We should have that information by then and can talk about that as well as we continue to ramp things up. And it would still be in time for budget. So It would be in front of the council for budget decisions as well.
Absolutely. And if there's any questions, I don't know how rigid those are, if they're state mandated or the design, you might work with HHS to see if there's something we want to capture that we're not already capturing. But I don't, I'll leave that to you all.
Mr. DeAndrea, go ahead.
I was just it is a state survey.
Yeah.
Okay. So so that's all right. So there's no flexibility there. But yeah, I think the information would be very helpful. Thank you.
Definitely.
Anyone else, for anything else that I missed that you wanted to make sure that we added in terms of requests for our December follow-up meeting? Okay. If not, I really just want to say thank you again to all of the partners. Look, at the very end of this, it's been hard. And we know that we've heard it from parents, we've heard it from students about how challenging it has been during this time frame. We understand that being out of school was also a challenge. It affected folks' mental health. It affected some of their academic performance in terms of not being in the classroom. We get all of that. But we also led with safety. So we had to balance the two things, understanding that from an academic performance perspective, we knew that there would be some challenges for many, but then we also knew that we would also be putting children's lives and their families' lives at risk if we just sent kids back to school. And so from that perspective, we really tried to come up with a balanced approach in how to do this. I think that we've seen from where we've been successful in the mindset of our community that is overwhelmingly for our 12 to 15 cohort embraced getting their kids vaccinated. I know that, my child who's in high school and has been able to get the vaccination, and it's just tremendous in terms of the response from all of the folks in the greater community. And we've seen that, especially amongst our young people. And so I just want to encourage those parents, again, that are 5 to 11, please go and take a look. There are appointments available. Please take a look at the county's website as well as the state's website, both the PrepMod system and the Montgomery County COVID website that does have our county vaccination clinics and has a list of every single one of the private providers that provide vaccines for 5 to 11, as well as the doctors who are, or the doctors' practices that are distributing the vaccine as well. So check and see if your practice or your doctor is on that list. If not, then you know you need to look to one of our private providers or the community clinics. And so just a little bit of a service announcement for those out there. That information is there. I encourage you to take a look. And please, if you have any questions, reach out to your council members. That's what we're here for as well, to help you through this, or call our Department of Health and Human Services. They will help you and walk you through this process. I hope that everybody continues to stay safe. I stole Dr. Kroll's line. But want to make sure that everybody is mindful. We still have a virus that's out there, and we still need to make sure that we're continuing to protect ourselves. So take care, everyone. We are adjourned.